I'm Liz Brosden, the Executive Director of Christie's Place. We're a San Diego-based nonprofit social service organization that provides comprehensive HIV education, social services, and advocacy to women, children, and families who are impacted by HIV and AIDS. We're the only organization in San Diego whose mission is dedicated to empowering our clients to take charge of their health and wellness, ultimately building the strength, health, and resilience of families impacted by this pandemic, some of our county's most vulnerable residents.
So Christie's Place set out to change the status quo, and we did this by pulling together a collaboration, a network of providers who could come together to better serve women in our community. So the Change for Women program, Phase 1, was all about going out and identifying women who had fallen out of care and bringing them back into the system. We really looked at what issues women were facing and addressed each and every one of those barriers in order to ensure that they were able to get the life-saving medical care that they needed. Well, we did a fantastic job in doing that. We brought over 250 women back into the system. However, now that they're here, we realized that we needed to provide further service in order to ensure that they retain medical care.
In 2013, Christie's Place launched Phase 2 of our Change for Women program, which is a social justice-oriented, trauma-informed, and gender-responsive programmatic expansion, which really focuses on trauma-related barriers to retention in healthcare for women of color living with HIV.
Because women have been marginalized throughout history with HIV, and these are services that are important to keep them engaged into care and to keep them engaged in their lives. Without Christie's Place, I've seen many women fall to the wayside, both from their HIV stigma and HIV disease.
Through our partnership with UCSD Medical Center, we were able to create a Women's Center of Excellence in HIV healthcare. And we've seen some really great results from this component of the Change for Women program. In fact, 82% of the women that we went out and found and brought back into the care system have now achieved viral load suppression. So these women are truly healthier, they are truly living a better life, and they are doing very well.
Alliance Healthcare Foundation continued support is vital in helping Christie's Place continue to support women, children, and families who are impacted by HIV and AIDS. We are the only support center, we are the only place for this population to go.